Ooh, so I think this is a great question that not a lot of people ask and not a lot of people talk about. This person wants to know, can you be pre-diabetic if your hemoglobin A1C is normal? And the answer to that is there is a possibility. As first and foremost, I don't go around diagnosing people. That is not my job. It's not in my job description. It's not in my scope of practice. That is something that your doctor can do, at what they're licensed to do. But the hemoglobin A1C test is not the only diagnostic test. There is the oral glucose tolerance test and the fasting plasma test. I should say the fasting plasma glucose test. So with the oral glucose tolerance test, the way that it works is they take your blood sugar before you drink a sugary solution. They test your blood sugar. And I should mention you're fasting. You're going to be fasting for 8 hours. So they take your fasting blood sugar and they give you a sugary solution. And after they give you that sugary solution, they're going to wait about 2 hours and then they're going to take your glucose test. If your blood sugar 2 hours after is between 140 to 199, 2 hours after drinking that sugary solution, and of course they're comparing it to that fasting, then you may need to talk to the doctor and the doctor may give you a diagnosis. For the fasting plasma glucose test, which is a test that, we see a lot when we take our routine labs, again, it's fasting. And if your number is between 100 to 125 fasting, then you may get a diagnosis. So the hemoglobin A1C is not the only test. It's a popular test. It's a more commonly known test, but it's not the only one.